What I'm about to tell you could completely change the way you feel every single time you swallow your blood pressure pill. Because if you're taking amlodipine, losartan, or lisinopril, there's a very real chance that something you've been blaming on age, on stress, on a bad night's sleep, or on simply getting older is actually a quiet signal. A signal that the medication keeping your numbers beautiful is also doing something inside you that nobody ever paused to explain. And that's the part that keeps me up at night. Because in all my years of practice, people rarely get hurt because the medication was the wrong choice. They get hurt because they were handed a bottle and sent home with only half the story. They never learned what to watch for, so they missed the warning until it became something serious. Before we begin, please subscribe to my channel so you never miss clear, honest, life-protecting health guidance made for you. I'm Dr. Caleb Mercer, and if you've been told to take amlodipine, losartan, or lisinopril for your blood pressure, there are 11 things I need you to understand right now. Not because your doctor is keeping secrets, but because appointments are short, time is tight, and most patients walk out the door with a prescription in one hand and 100 unanswered questions in the other. By the end of this video, you're going to know which symptoms are harmless, which ones are warning shots, which ones sound like nothing but absolutely are not, and why the single most important truth in all of this has nothing to do with how perfect your numbers look on paper, and everything to do with whether you can actually live safely with the medicine in your body for years to come. Let me begin with Dorothy, because her story is exactly why I had to make this video. Dorothy was 72, sharp, faithful with her medicine, the kind of patient who wrote down every reading in a little notebook. Her blood pressure was textbook perfect, but one afternoon she sat across from me, embarrassed, and admitted she'd been getting dizzy nearly every time she stood up from her chair, and twice she'd had to catch herself on the kitchen counter. She thought she was just tired. Her daughter thought it was her age. What nobody had explained to Dorothy was that the very medication controlling her pressure so beautifully was also doing something her body hadn't yet learned to handle, and that the answer was not to suffer through it quietly. That brings us to number 11, the first thing there's rarely time to spell out. These 3 medications are not the same pill in 3 different costumes. Amlodipine is a calcium channel blocker. Losartan is an ARB. Lisinopril is an ACE inhibitor. Yes, they all lower blood pressure, but they take completely different roads to get there, which means they leave completely different footprints on your body. If you don't know that, you will misread your own symptoms. You'll assume all blood pressure medicine behaves the same way. It doesn't. Amlodipine relaxes blood vessels in a way that commonly causes swelling in the lower legs. Lisinopril is famous for a stubborn, dry cough. Losartan is often the medicine doctors reach for precisely because it usually spares people that cough. Same destination, different path, different clues. And here's why that matters more than you'd think. If you start coughing on lisinopril and assume every blood pressure drug will do that, you might quit treatment entirely. If your ankles swell on amlodipine and you assume your heart is giving out, you may live in fear for no reason. And if you feel completely fine on losartan and assume there's nothing to monitor, you may miss a potassium problem building silently behind the scenes. The name on the bottle tells you the class. The class tells you the pattern. And once you understand the pattern, your own body stops frightening you. Number 10 is the one Dorothy was living through without realizing it. Dizziness and lightheadedness, especially when you stand up. With all 3 of these medications, particularly when you first start them or when the dose goes up, your body needs time to adjust to running at a lower pressure. And in that adjustment window, standing up too quickly can make the whole room tilt. People wave it off. Oh, I just stood up too fast, maybe. But in older adults, 3 seconds of dizziness can become a fractured hip, a head injury, or a fall you never fully recover from. Let me tell you about Howard. Howard was 79 and fiercely independent. 2 days after his amlodipine dose was increased, he got up in the night and the floor seemed to shift beneath him. He grabbed the doorframe just in time. He didn't fall, but it terrified him. And worse, he told no one. Nobody had warned him to rise slowly, to sit on the edge of the bed first, to let his body catch up before his feet hit the floor. That is the difference between handing someone a pill and actually preparing them to live with it. Mild dizziness often settles, but near fainting is never something to endure in silence. Number 9 is something people brush off for far too long. Lisinopril can cause a dry, nagging, relentless cough. And what almost nobody tells you is that this cough doesn't always start right away. Sometimes it begins within days, sometimes weeks, and sometimes it shows up months later, which is exactly why people never connect it to the pill. They blame pollen, dust, reflux, a cold that won't quit, or dry winter air. The cough is scratchy and irritating, not wet, not productive, just there, often worse at night, robbing people of sleep. Bernard learned this the hard way. He was 70, and 4 months into Lisinopril, he developed a tickle in his throat that never left. The nighttime coughing fits drained him. He bought lozenges, switched detergents, even replaced his furnace filter. Nothing worked. When I asked when the cough started in relation to the medication, he looked stunned. No one had told him the Lisinopril cough can arrive late. But here is what I need you to hold on to tightly. A dry cough is usually annoying, not dangerous. The symptom that should make you move immediately is swelling of the lips, tongue, face, or throat, especially if breathing or swallowing becomes hard. That is not a wait until Monday situation. That is emergency care right now. ACE inhibitors like lisinopril can, in rare cases, cause something called angioedema, and it can turn life-threatening fast. So when I say cough, don't panic. When I say tongue or throat swelling, you move. Number 8 hides in plain sight, right there in the grocery store. If you take Losartan or Lisinopril, potassium matters. And most people hear that and think, I don't take potassium pills, so I'm fine. Not so fast. Potassium isn't just in a supplement bottle. It's hiding in salt substitutes, heart-healthy seasoning blends, electrolyte powders, and certain meal replacement drinks people use without a second thought. Both Losartan and Lisinopril can raise your potassium, and too much potassium can disrupt the electrical rhythm of your heart. It doesn't always shout. It can whisper as weakness, cramping, tingling, fatigue, a fluttering heartbeat, or sometimes nothing at all. Let me tell you about Vernon. Vernon was 74 and trying so hard to do everything right. He cut his sodium and proudly switched to a salt substitute, certain he was helping his heart. What he didn't know was that many salt substitutes simply swap sodium for potassium. So there he was, taking Losartan, which raises potassium, and seasoning every meal with even more of it. He grew weak, felt his heart skip, and by the time his blood work was checked, his potassium was high enough to demand urgent attention. Vernon wasn't careless. He was trying to be the perfect patient. Nobody had connected the dots for him. That gap is exactly where good people get hurt. Number 7 is the truth about your kidney numbers. And this one frightens people so badly that they sometimes stop their medicine at the very moment it's protecting them. Losartan and Lisinopril aren't only blood pressure drugs. In the right person, they can actually protect the kidneys and the heart over the long run. But when you first start them, or raise the dose, your doctor may check your labs and see a small shift, a slight rise in creatinine, or a small dip in kidney filtration. To many patients, that looks like proof the medicine is destroying their kidneys. Sometimes it is a real concern, and yes, but often a small early change is expected because these medications change the pressure dynamics inside the kidney's delicate filter. That's precisely why the blood test exists, and why guessing is so dangerous. Pauline nearly made that mistake. She was 71, with high blood pressure and early kidney trouble. I started her on Lisinopril specifically to help protect those kidneys. 2 weeks later, her labs shifted slightly. She saw the results in her online portal before anyone could explain them, panicked, and was one click away from quitting. When we spoke that evening, I told her the real question was never just, did the number move? The real questions were how much, in what direction, and what else is going on. A mild, expected, supervised change is a completely different animal from a dangerous decline. That's why follow-up labs aren't optional theater. They are part of the treatment itself. Number 6 is one of the most overlooked dangers in older adults. Dehydration changes everything. If you take Losartan or Lisinopril and then you get a stomach bug, vomiting, diarrhea, a poor appetite, or you sweat heavily in summer heat, the medicine that helped you yesterday can hit you completely differently today. Your pressure can drop too low. Your kidneys can come under strain. You can feel dizzy, weak, or faint, and in some cases slide into real kidney trouble faster than you'd ever expect. The drug didn't betray you. Your body's fluid balance changed, and now the same dose is working in a totally different internal environment. This is one of the biggest nobody told me moments in all of blood pressure care. Clarence was 78 when it caught up with him. He had a brutal stomach virus, couldn't keep anything down, but still took his Losartan every morning, proud he'd never missed a dose. That evening he stood up and nearly collapsed. In the emergency room, the problem wasn't that Losartan was a bad drug. The problem was that his body was drained, his pressure had bottomed out, and his kidneys were struggling. What he needed wasn't blind loyalty to the pill bottle. He needed a sick day plan, and the knowledge that illness can change the rules. Number 5 is the trap sitting in millions of medicine cabinets, and at first, it looks like it has nothing to do with prescriptions at all. Ibuprofen, naproxen. Those just for my knee, just for the weekend, just for my aching back pills. If you take Lisinopril or Losartan, and especially if you also take a water pill, regular use of these anti-inflammatory pain relievers can create a perfect storm for your kidneys. This one genuinely shocks patients because each piece feels so harmless on its own. A blood pressure pill, a pain reliever, maybe a fluid pill. Nothing sounds dangerous. But together, particularly with any dehydration mixed in, they can choke off blood flow to the kidneys and raise the risk of kidney injury. And most people never even mention the over-the-counter pain pill to their doctor because they don't think of it as real medicine. Gloria did exactly that. She was 73, took lisinopril and a water pill, and used ibuprofen several times a week for the arthritis in her hands. She thought she was managing wonderfully. Then her labs worsened and her pressure turned erratic, and everyone scrambled to figure out why. It was no mystery. It was the combination. Once we removed the daily anti-inflammatory and found safer options for her arthritis, things improved. Over-the-counter pain medicine is not a casual topic when you're on these drugs. It's a serious safety conversation. Number 4 is the side effect people normalize until it lands them in real trouble. Swelling in the ankles and legs from amlodipine, one of the most misunderstood symptoms in all of blood pressure medicine. People assume it means too much salt, weak kidneys, or simple weight gain. But with amlodipine, the swelling often happens because the tiny arteries relax more than the veins do. Blood flows into the legs easily, but struggles to flow back out. Pressure builds in those small vessels and fluid seeps into the tissue around the ankles. That's why people say, I'm fine in the morning, but by evening, my socks leave deep grooves in my skin. Let me tell you about Raymond. Raymond was 76, and every afternoon his ankles ballooned. He decided it was just old age. He started skipping doses on the days he wanted to leave the house, embarrassed by how his legs looked. And that, right there, is how a manageable side effect quietly becomes uncontrolled blood pressure. The swelling didn't mean amlodipine was wrong for him forever. It meant a conversation needed to happen, not silent suffering and skipped pills. Number 3 is where so many intelligent people accidentally sabotage themselves. They glance at one reading, see a high number, and decide the medicine has failed. Or they see one low number and decide it's too strong. That is simply not how blood pressure works. It moves constantly with sleep, pain, stress, posture, caffeine, conversation, even the anxiety of taking the reading itself. A single number is not a verdict. It's a snapshot. What matters is the pattern over time, not one startled glance at the monitor on a Tuesday morning after a bad night's sleep. Beatrice was 67 and checked her pressure every time the slightest worry crossed her mind. A headache, she checked. A stressful news story, she checked. A high number, she checked again 2 minutes later, then again, until she had pages of numbers and a heart full of dread. She was certain her lisinopril wasn't working. But when we slowed everything down, used the same time each day, and had her rest quietly before measuring, a completely different picture emerged. The medicine was doing its job. The chaos was in her method, not her medication. Because once someone decides their drug has failed, they start making impulsive choices, doubling up, skipping doses, demanding changes based on noise. Good medicine plus bad interpretation produces bad outcomes every single time. Number 2 is about timing, and I cannot overstate how often this creates needless danger. These medications work best taken consistently, same time, same routine, same system. If you miss a dose, the answer is usually not to double up later, unless your clinician has told you otherwise. Most instructions say to take the missed dose when you remember, unless it's close to the next one, in which case you skip it and return to your normal schedule. Do not take 2 at once. Yet people do it constantly, terrified their pressure will climb, and then they get dizzy or weak from a drop they cause themselves. Stanley was 75 and faithful with his pills, except when he wasn't. If he forgot his lisinopril in the morning, he'd take it at lunch, then talk himself into another by dinner, just to be safe. One night, after a high home reading, he took an extra tablet because he feared a stroke. The next day he was flat on his back, washed out and unsteady. He wasn't reckless. Nobody had ever told him these are not rescue pills for sudden spikes. They are long-game medicines that work through steady, patient, consistent use, never emotional reactions. If you don't know what to do when you miss a dose, ask. Guessing with these drugs feels small in the moment, but it can create very large problems. And now, number 1, the single most important truth I rarely hear, said out loud clearly enough. The best blood pressure medication is not the one that gives you the prettiest number for 3 weeks. It's the one you can stay on safely, consistently and intelligently, because it fits your body, your symptoms, your other conditions, your labs, and your life. That is what people miss. A medication can look like a triumph on the chart while quietly failing in the real world. Because you hate how it makes you feel, you don't understand its warning signs, or you've secretly started avoiding it. Amlodipine may be perfect for one person and cause miserable swelling in another. Lisinopril may protect the kidneys beautifully while a dry cough destroys sleep night after night. Losartan may be a wonderful alternative, but it still demands respect for potassium, kidneys, and hydration. Let me tell you about Frances, because her story ties all of this together. Frances was 70 with gorgeous numbers on Lisinopril. Any doctor glancing at her chart would have smiled. But Frances coughed every night, slept terribly, and had begun to dread that pill. She told no one, certain the answer would be, "You need it, just live with it." And that assumption is exactly where patients vanish. First they resent the medication, then they forget it on purpose, then they stop entirely, and then the pressure climbs and everyone acts surprised. Frances didn't need a lecture. She needed a medication plan that actually fit her body. Once the cough was recognized as likely medication-related, her treatment was reassessed and adjusted. That is good care, not pushed through at all costs. The person matters as much as the pressure. Here is what I need you to carry with you. Side effects are not weakness. They are data. Swelling is data, cough is data, dizziness is data, weakness after a stomach bug is data, a pounding heartbeat, stubborn lightheadedness, muscle cramps when potassium drifts off, those are all pieces of information. Your job is not to diagnose yourself. Your job is to notice the pattern and report it. Too many people think being a good patient means never complaining. Absolutely not. A good patient pays attention. A good patient speaks up early, before the throat is swelling, before the kidneys are struggling, before the pressure is wildly out of control because they quietly quit 3 weeks ago and told no one. Silence is not strength here. Silence is risk, and risk grows in the dark. So let me hand you the practical framework I want with you every time you take these pills. If you take amlodipine, watch for ankle swelling, flushing, headaches, dizziness, and that heavy-legged feeling by evening. If you take lisinopril, watch for a persistent dry cough, dizziness, and any swelling of the lips, tongue, or throat. If you take losartan, watch for dizziness, weakness, dehydration during illness, and signs that potassium may be climbing, like muscle weakness, cramping, pins and needles, or an irregular heartbeat. With losartan and lisinopril especially, blood tests matter. With all three, consistency matters. And with every one of them, a symptom you cannot explain is worth a phone call. You do not need certainty to pick up the phone. You only need a pattern that concerns you. And let me ease one more fear before we finish. Not every side effect is a catastrophe. A mild headache when starting amlodipine may fade. Early dizziness as your body adapts may settle. A dry cough can be a nuisance without being dangerous. But not every side effect should be endured forever either. There's a real difference between "this may improve in a few days" and "this is stealing your quality of life." Patients blur that line constantly, panicking over the manageable and minimizing the serious. The answer is never panic and never denial. The answer is understanding. Because the moment you know which class of drug you're taking, how it behaves, and which red flags cross from nuisance into urgency, the fog lifts. You stop imagining every symptom is the end, and you stop pretending the obvious warnings mean nothing. That balance is exactly where safety lives. Not in ignorance, not in obsession, in understanding. And once you understand, you become far harder to harm, because you stop being passive with powerful medicine. If this helped you, share it with someone who takes blood pressure medication, because there's a very good chance they need to hear it too. And as always, I'll be right here in the next video, helping you understand the health truths that matter before they become the emergencies you never saw coming. That is exactly why this channel exists.